Okay, glad to have you back on this segment, and if you're just joining us, you're right on time because the show is just about to begin. And today we're going to be talking about something really peculiar to the female gender. Recently, we've seen a lot of videos of people telling us stories of how they did a lot of things. Let me make reference to the fact that Warri Pikin shared her story on how she did her weight loss surgery. There's another lady I saw on social media too. She came out and said her story of how she did her weight loss surgery too. And recently there's a lot of like upsurge. Everybody's talking about it, doing cosmetic surgery, plastic surgery, doing weight loss surgery. Everybody's talking about liposuction, and it seems like we don't really understand which is which. Before, I thought maybe liposuction is about the weight loss surgery, but I found out that there's a difference between liposuction and weight loss surgery. So today, I know so many of us have many questions and we need to clarify a lot of doubts about these procedures in particular. So we're going to be discussing plastic surgery, the upsurge in BBLs and liposuction procedure with a guest in the studio. Let me take his profile before I introduce him. He's the founder of Ebony Aesthetics. He's a certified consultant aesthetic surgeon. He's a fellow of West African College of Surgeons. He's a fellow of Medical College of Surgeons of Nigeria. And his name is Dr. Chukwuma ChIjoke. You're welcome to the show.
Thank you for having me.
Well, it's good to have you join us today.
Thank you for having me.
How are you doing?
Fine.
Okay. The first thing that came to my head, forgive me, when he came as a surgeon, I don't know if he was thinking of how he can help us enhance our body. I think that's the first thing that came to my head.
When I saw the topic, I wanted to stand back and chat to you, like, are you thinking of going into that direction? Because, like you said, it's an upsurge.
Yes, actually. Yeah. And I noticed that since Warri's video, Warri Pikin's video came out, people have now been coming out to say, oh, this is what I actually did. And I saw a particular lady that came out to say that when she went to do her own surgery, she saw a lot of people that are brand ambassadors of some slim teas come out to do that surgery, and that she didn't want to mention names so she doesn't spoil that business for them. So that's on the side though, but I would like you to let us know. We're talking about plastic surgery, we talk about cosmetic plastic surgery, we're talking about liposuction, weight loss surgery, BBL, there's a lot, breast uplift or implants or the likes of them. So let us know the difference. What exactly is plastic surgery, and what's the difference between plastic surgery and cosmetic plastic surgery? Okay,
well, in recent times, the upsurge has been from the celebrities, influencers, you know, and there's been a lot of confusion out there concerning the terms used. Yeah, there is cosmetic surgery, which is body contouring. Body contouring, that is body shaping. That's when you talk about liposuction, breast lift, breast reduction, tummy tuck, and all that. Those are for reshaping the body.
The body, okay.
Yes, not really for weight loss. Yes, cosmetic surgery is not for weight loss. Now there is another group of procedures called weight loss surgeries. In medical parlance, we call them bariatric surgeries.
Okay.
Yeah, bariatric surgeries are procedures done for weight loss, strictly for weight loss.
Oh.
Yeah, so there are two different areas, cosmetic surgery and bariatric surgery. They are two different entities completely. So when you talk about bariatric surgery, you talk about surgeries that will help you reduce the volume of food you consume.
Okay.
Or surgery that will help you to reduce the absorption of food consumed. So I mean, they are all internal procedures. They are not on the skin. They are all deep in the abdomen. Unlike cosmetic surgeries, that is mainly what people see on the skin. You understand? So that's just the difference.
Okay. Let me come in. I was hearing about making reference to Warri Pikin, and in her testament, she made mention of the fact that what they had done to her body. You know, most times really man that are not in your field will say, do not bug me with the terminology. So what they had done on her body was to help her reduce the amount of intake of food. But then we still saw the physical, where they had removed some flesh from her body. Could that also be considered as the surgery part? Is there a surgery part to the weight loss before even the internal parts where you are help to reduce the amount of intake of food you have?
Okay, well, when one loses significant weight, there's a lot of skin that sags. So imagine someone with large pot belly or protruding abdomen, and then you lose a lot of weight. You know, the skin don't just disappear. You know, just like a deflated balloon. Sorry to use that word. You know, the skin sags. So that's where the cosmetic surgery come. Cosmetic surgery now reshapes the skin to be, you know, flat, smooth, without sagging. So it removes the excess skin, removes the other stubborn fat that has not been removed by the weight loss surgery. So most of the time, when you do weight loss surgery, you may still require cosmetic surgery.
May?
Yeah, usually you will, because some of the, depending on how, usually when one loses weight, significant amount of weight, or when one gets pregnant and then after pregnancy, the abdominal skin sags, you know, especially when you have multiple pregnancies, you understand, the abdominal skin sags. So exercises can't really take out that skin because it keeps sagging, you understand, and then what we also call stubborn fat. It doesn't really disappear, but you actually have your normal weight, your normal BMI, or within the range. You understand? That's where you can do cosmetic surgery. But if you're obese, you know, you're big, you can't really do cosmetic surgery. What you need would be weight loss surgery.
Okay, now let's talk about that weight loss surgery. Can you explain the process for us? The process whereby you get to lose weight? Because like what Victoria mentioned earlier, some people, we have seen videos of people that do weight loss surgery, and by the time they are telling us their story, they look really slim, and they tell us that they just took us a part of their stomach out or something. So what is that process of that weight loss surgery that does not require cosmetic surgery? Because so they are coming out to tell us now that it's just a weight loss surgery, not a cosmetic surgery. No fat was taken out of their body. So tell us, how did that fat disappear?
Well, you know, when you do weight loss surgery,
Okay.
there are different types,
Okay.
but with the same goal. And there are two goals. The goal is reduction of intake.
Okay.
How that happens is that, imagine your stomach is in 4 and more than half is taken away. So you only have less than half remaining. So the quantity of food you eat normally, if you drink 1 liter of water, 1 liter of water can't enter there again. So you might require maybe more than half of that liter.
Okay.
So by consistently reducing the volume of food you take, because you can't take more than the size of your stomach.
Yeah.
So because the size of your stomach is small, you have to take little. Little is enough to get you full. So because you get full with little, you don't take much for a long period of time. So you lose weight.
Okay, gradually.
You lose weight. Yes, gradually you lose weight.
Okay.
Because you just can't take more. Then there's another part of weight loss surgery that you're taking, in addition to reduction of what you're taking is, most of it is also not absorbed into the body. So it's diverted.
Okay.
So
What's the name of that type?
Yeah, what? Roux-en-Y, gastric bypass,
Okay.
then biliopancreatic diversion. These are big terms, you know. But the essence is that the idea is that the food that you taking is not, the nutrient is not absorbed.
Absorbed on the body.
Yeah, nutrient is not absorbed, so it's diverted. So you pass most of the nutrients off. So by so doing, over time, you lose weight.
Okay, so I want to ask, when should people seek weight loss surgery? Because, come on, what happened to being fat and being sexy and okay? Why should people want to just reduce their weight? So at what point do you think anybody, because like we said, there's a high surge of people seeking weight loss surgery. Why should or when should people seek weight loss surgery?
Okay, that's a very good question. That's a very good question. Why I say it's a good question is that even though there is increased awareness about weight loss surgery, it's not for everybody.
Okay.
Do you understand? It's not for everybody. The best weight loss would be the natural kind of weight loss, where you reduce the quantity of food you take and then you do exercise.
Why do you use the word best?
Because it's natural. You don't have to undergo the procedure. In fact, weight loss surgery is not the first option for losing weight.
Okay.
It's rather the last
option.
Yes. The first option would be the normal thing we would do. You know, do exercise, reduce what you eat. You understand? In some instances where people are morbidly obese, what I mean is that, you know, the obesity is now posing a health challenge. You understand? The obesity is now posing a health challenge. It's causing cardiovascular problem. It's causing sugar or blood pressure to rise, and it's causing a lot of problems. And you are just too big. Exercise might be a problem because you're even having joint pain. You understand? In those cases where there is problem to the health, the obesity is causing problem to the health status of the person, then bariatric surgery is a good option. But for an average person, young person, bariatric surgery is not an option first. I mean, you do exercise, you work out, burn the fat, you lose weight, and then you do dietary modification. You don't eat so much. You just eat the little you can that can be burnt by your daily activity. Avoiding sedentary lifestyle, you know, sitting all day long. I mean, you need to move out to burn what you've eaten. You know, so what in summary, weight loss surgery is not the first option. Yeah, it's rather the last option when the other options have failed.
But looking at the fact that our Chidinma, our natural ways, which you, as you termed it to be, of losing weight is not realistic, so to speak, because I, for one, I love to eat, and I love to eat good food, and perhaps I was much more slimmer than this. And just for me, what about Chidinma, or what about someone else there? Okay, it seemed not to be very realistic. So do you consider it now, since it's not realistic, maybe we could often just jump at the weight loss surgery?
No, losing weight is realistic.
The process that comes with it, how would you say?
Yeah, no, it's a matter of being disciplined. Now, the reason why I'm making the weight loss surgery as the last option is that there's no surgery without risk.
Okay.
Not as if it is not without risk. Anything that go wrong, as far as there is surgery involved. Remember, you're going to be anesthetized. Yeah, the surgery is inside the abdomen, involving your stomach and intestines. Okay, so anything can go wrong, and there could be some side effects as time goes on. You know, nutritional problem. Remember, a lot of nutrients are being diverted off. You're not taking enough, and the one you're taking, depending on the one, the type of procedure, a lot of nutrients are diverted. So you're going to have some nutritional deficiency over time that can be corrected anyway. Do you understand? So yeah, and then there is also other side effects.
Okay, I would like you to let us know, because I was going to that aspect now, because you mentioned the fact that there's a kind of surgery you can do, and it will be taking out the nutrients from your body, and we know that we have been taught that we need nutrients for us to be able to be healthy. And how do we now replace those nutrients in the body? What are those side effects that are involved in this weight loss surgery that we should look out for? Because everybody's coming out and making it seem like it's just easy, just go and do it and you come back and you'll be fine. Like I think there is nothing there. It's making me want to tell Victoria, just go for a weight loss surgery. You get? So it sounds, everybody makes it seem like it sounds very easy and there is nothing attached to it. Okay, I was even thinking, like, is it also a permanent solution? Is it possible that someone loses weight now through the weight loss surgery, and it's possible that you now add more weight again later?
Okay, well, like I said, weight loss surgery is not the first option. Okay, now whether you can add weight later after doing weight loss surgery, some of the procedures are permanent. Like when the part of the stomach is removed.
It can't expand back?
No, it's removed.
Really?
Yeah, so it's permanent. It's permanent. Some of the diverting nutrients that will be absorbed, the calories, you know, you absorb little, not as if you're completely not absorbing anything. Because if you don't absorb anything, then you're not alive. So some parts is absorbed, but other parts is not absorbed. It just passes through and then passed away. Okay. So there are risks involved.
I want to know those risks.
You want to know those risks? Well, okay. Now, the risks are in different stages of the procedure.
Okay.
Starting from the procedure itself, the surgery itself, and the anesthesia, because you're going to be sleeping for the weight loss surgery. A lot of it is done, you know, holes on the skin, what's called laparoscopic You know, laparoscopy means you're not making a big wound on the skin. You're just
Okay.
being, puncture holes on the skin to get access to the abdomen, abdominal cavity, So sometimes after making sutures, it could leak, just like trying to join two tubes together. The joining, there could be leakage at the edge, at the junction, you understand? And if there's leakage, you have to go in again, okay? Yeah, sometimes there could be nutritional deficiencies, you might have low iron, folate, and vitamins might be deficient because a lot of them are diverted away. Okay, sometimes you can become hypoglycemic weak because you're not having enough nutrients. And sometimes because calcium may not be absorbed in large quantity. Okay, you might have bone weakness. Okay, sometimes you can have kidney stones, because of the components that forms kidney stone increases. And so these are just little things, these are side effects that could happen over time, you understand? So that's why I said it's really the last option. You must reach to a certain degree of obesity before it's considered. That you're just overweight it doesn't make you a candidate for it. Just most people are overweight, not really morbidly obese. Morbidly obese is maybe somebody weighing 150, 160, 200 kg, BMI reaching 45, 40, you know that this person is big. But for average people walking on the street that are just obese, I mean, if that's why I say if you do exercise, for those average people on the streets that are not morbidly obese, if you do lifestyle modification, which is exercise, regular exercise, workout, and then dietary control.
But does exercise actually work? Working out, does it work?
It does. It does. If you join it with reduction of intake. Because some people, that's the problem. That's the problem because some people will work out and double their ration. because you just have to burn out more than what you take for you to lose weight. If you burn out more than what you take, you can lose. But if you burn less than what you take, the remaining gets, stored somewhere.
All right, then. How healthy must one be before going under the knife? Because I know that there is some surgery, depends on the case. They'll ask you, oh, your BP should have to be low first, or this or that. You're a doctor, so you should know. How healthy must one be before going under the knife? Okay,
because most surgeries, cosmetic surgery and bariatric surgeries, they're not emergency. They are planned surgery, meaning that it's planned, meaning that you have to be in the best state of health. Okay. The best state of health. Unlike an emergency that maybe you have a wound, you have accident, you have to go into the theater because you have an accident. So whether you're unhealthy, you have to go to the theater. But cosmetic surgery and bariatric surgery, they are all planned. Meaning that if you're hypertensive, it has to be optimally controlled. If you have high blood sugar, it has to be optimally controlled. If you have any other health problem that will pose a risk to this procedure, it has to be very, very controlled by the specialist involved in that particular health problem. So the risk profile has to be assessed, and the other tests that must be done before the procedure to assess your safety. So usually, for elective surgery, safety comes in because the client is healthy ab initio, relatively healthy though, Yeah, but so it has to be in the best state of health before it can be done.
Okay, so what is the quality of life after surgery? Does it affect one's lifespan?
Okay, which of them? Cosmetic surgery or bariatric surgery?
Bariatric surgery.
Okay, bariatric surgery, yes, very well. Just imagine someone who is weighing 160, 170 kg, and then the person coming down to 100 or 90. The weight, the fat is weight. When you're that heavy, you feel it's a problem to the health. Yeah. Yeah. The cardiovascular status, that is the strength of the heart, the strength of the lungs, the strength of the bones, high blood pressure, diabetes, they are all things that might arise from that magnitude of weight. You understand? So by cutting down that weight significantly, those health problems may be resolved.
Me.
Yes, will likely be resolved. For an instance, if you're weighing 160 or 170, I mean, your knees are carrying a lot of weight. Your ankles are, just imagine one carrying bags of cement walking around all day. That's how it is. So your knees are carrying a lot of weight. Your ankles are carrying your back. A lot of weight on your back. So pains. So when you lose that weight, the pains go down. You can walk longer. You can be off pain drugs. Okay? And then your heart has less work to do. Because just imagine that amount of weight has been taken away from your body. The heart has less work to do. Okay? So there is a lot of benefit. And sometimes for people who meet the criteria for weight loss surgery, it even prolongs their life.
Oh, really?
Yes.
So he has more advantage than disadvantage?
Well, relatively, yes. Relatively it has. Because by shedding that significant amount of weight, well, the risk is still there. But when you look at it, especially when you meet the criteria for weight loss surgery, when you are morbidly obese, yeah, the advantage outweighs the risk.
I have a question, sorry, for the female gender. Does this affect your fertility in any way?
No.
It doesn't.
No.
So a woman can still take in normally, despite the fact that I know it's the womb she takes in from, but I'm just saying, like, a woman can still take in normally and put to bed.
Yes, you can, but you have to be in contact with the doctor. If you've done weight loss surgery, because of the nutritional loss,
okay,
some of the nutrients are beneficial for the growth of the baby.
Yeah.
So if some of the nutrients are deficient, the baby might have some problems.
Oh. Can those nutrients be replaced with supplements?
That's why you need to see your doctor.
Okay.
Yes, you need to see your doctor. You need to run tests to know the level of those nutrients.
Okay.
And then plans should be made on replacements based on the level of the nutrients on the ones that are lacking. Because if these nutrients are deficient and you conceive, there are chances that, depending on the nutrient that is missing, some of the nutrients, if very deficient, the baby might be malformed, for an instance.
Okay.
You understand? Yeah. So
Okay. I heard you say you need to run tests, you need to see the doctors, and we all know that running tests, seeing the doctor, and cost little. So I want you to help us understand the cost implication of weight loss surgery. Does it cost much? Is it to some extent kind of affordable or meant for maybe those distinguished personnel out there, like the celebrities, of course?
Well, affordability is relative, you know, these days. What is affordable to this other person may not be affordable to the other person. But they are relatively, in the Nigerian eye, expensive. You know, the different price range is expensive. But for those who really want to do it, who made it, in fact, there are some patients that I will advise you just go for it. Yeah, there's kind of maybe a client walks into my office and say, okay, come and do liposuction, come and do tummy tuck. I was just, no, that's not what you need now. What you need now, you have to shed weight before those procedures can be done. You understand? So it's expensive, but for those who really need it to improve their health status, yes, it's good.
Okay, I think we'll have to go on a short break now.
Thank you.
Okay, viewers, we'll be going on a short break, and when we return, Engendered continues. We will be right back.
Well, glad to have you back again. If you're just joining us, we're still watching Engendered, and we've been joined with our guest from the first half. Of course, this is the second half, and we've been discussing, of course, weight loss surgery and an aspect of, well, that's where we are going to, the cosmetic surgery.
So I would like us to go to the aspect where we talk about the popular one, like really popular that everybody wants to do these days. We're talking about the cosmetic surgery. That's where we have the butt enhancements, breast uplifts, and the likes of them. So I'd like you to let us know, what exactly is liposuction?
Okay. Well, just like the name, suction. Lipo means fat. You know, it simply means suctioning fat. That is yours. Removing the fat.
Removing fat from the
body.
Yeah,
fat removal. You know, there are some fats that are claimed to be stubborn. You know, after all the exercises and weight loss, I mean, some of it just are they are not they are not proportionally distributed on the body. So you might have the arm slim, the tummy big, you know, that kind of uneven fat distribution and on the entire body.
Okay.
So you can some people with slim legs, slim hands, and then the abdomen is just that big, despite having done all the exercises and so some of it could be stubborn fat or excess skin. So that's where the liposuction come in, you know, reducing the tummy, the fat on the tummy, arm, thigh, depending on the area of the body where you want the fat removed.
Okay, so when these fats are removed, some people, we've heard that they take the fat to other parts of the body. You can put it in the butt to increase the butt, and where else do they put the fat?
I don't know.
So I want to know, please, how safe is this? Taking fats from a body, because it makes me remember, I'm sorry to use this example, but it makes me remember dialysis. It's like taking like filtering it and putting it back into the body, and it's a rigorous process. So how safe is this process that you take out fats, for example, from the stomach, and then you want to now put it in the butt for the person to have a bigger butt?
Okay, well, like I said earlier, there's no surgery without risk.
Okay, yes.
Yeah, there's no surgery without risks. In fact, the risk is even more with fat transfer.
Oh wow.
Yeah. Is more with fat transfer because of the the procedure. Liposuction has little risk.
Okay.
But when you now involve the fat transfer, there's some increase in risk.
Oh.
Yeah, there's some increase in risk. But usually, all safety measures will be taken in preparation of the surgery and even after the surgery. But even in the best of places in the world, some things can go wrong. Yeah, some things can go wrong. So that's where the problem is.
Well, there's what I don't think that could go wrong.
well, for the lipo, and most of the things that can go wrong with lipo, they are usually not life-threatening. Maybe just have fluid accumulation, or patient is not satisfied, or some uneven fat removal. You know, yeah. But for BBL, Brazilian butt lift, that is the fat transfer to the butt.
Okay.
What could go wrong is maybe the fat accidentally or inadvertently finds its way into the blood.
Wow.
That's the highest of it.
Really?
That can go wrong. Yes.
What does it do when it enters the blood?
When it finds way into the blood, it could get to places where it shouldn't ordinarily go to. The lungs, the chest, the brain, you know, it can go anywhere because it's in the blood. The blood goes around the body, so it can go anywhere that the blood goes. So when it goes there, it could block, maybe get the blood vessels decrease in size, so the places where the fat can pass beyond, it will just block it. So that could be any part of the body.
Okay.
The brain, the chest, and so on and so forth. So that is really not that common. Yeah, it's in few instances.
But it's a risk.
Yes, it's a risk, just like every other surgery. Yeah, it's a risk. Every surgery has risk. This one, fat transfer seems to be, has risks too, more risk relatively, relatively. So
Okay then. But why do you think there's a search? Because recently I heard some influencers say, if you have money, you want to do BBL, do it, my sister, do it. Okay, but with this risks associated with all these things you've said now, the risks associated with it, why do you think people still, there's this surge in people want to do BBL?
Okay, well, for some people, the body is like a brand. The first impression people make about you is your outlook. Normally, that's what happens. No, I've not seen you before. I'm seeing you for the first time. The first impression I make is your appearance. So some people want to prove on that. They want to get more self-confidence. They want to have clothing fit well. For instance, you're giving birth to like 3-4 children and you're out of shape, different from what you were before the whole pregnancy and giving birth. You're out of shape. You want to come back to how you were before. So, I mean, these are things, the reasons why people do the procedures. You know, you want to get more confidence. For some others, people have different reasons. You know what I mean? People are different. Some people want to do it to attract
To
more.
sell their market.
Yeah, I want to sell the market, you know, or attract. But for me, the reason shouldn't be, it shouldn't be influenced. One shouldn't be influenced to do those things.
Okay.
You should already decide on your own that this is what I want to do. You understand? It should be a personal decision. This is what I want to, not pushed into it.
Okay, I want to ask, because I see videos. I see where they're always doing this, going back and forth with a pipe, and then they want to now push it in. Is there a situation where maybe there could be a leakage? Maybe it's not properly sewn, or it could burst or something. Is it possible?
You mean like BBL?
BBL, yes.
Chidinma, the real facts. Like, I don't get.
You mean the liposuction?
Yeah.
I think what
I'm
you're talking about is liposuction.
the bib. I see them remove like from the stomach. They take it out. Then when they insert it to the bib, I know there will be a place where they will cut, right, and put it, right?
Well,
Yes.
just the cut is like a pencil, as small
Okay.
as small as the size of a pencil.
Oh, okay.
Just
So if there's no tendency that is going to burst or is going to leak. It's not going to.
It's flat now. It's not like a balloon inside that can burst.
Oh, okay.
It's not like a balloon.
But is it safe? Is it like healthy to just take out fat and put it in? Do they treat it like when they bring out the fat? Is it possible? Do they treat it before putting it back, or they just put the fat they get back into the body like that?
Okay, well, once the fat is taken from the body with liposuction, you have to remove the you want the pure fat.
Okay.
You understand? Rather than the fat mixed with blood and water and all that. So you just have to wait. You have either you process the fat definitely, so they can get the fat alone and transfer.
Okay, recently I was discussing with someone, and the person made me understand that this BBL of a thing has been in existence but long ago outside the country, but it wasn't rampant in Nigeria. And when it was just those dignified people like maybe president's wife and the rest that get to do it. But now it's really, really common. And the person also mentioned that perhaps it's just the time phase and it's going to fizzle out. He made example of when there was a time where fair girls were often the talk of town. Everybody wants to get married to a fair girl. You want to be part of a fair girl's life or something like that. Then you started bleaching. Everybody wanted to bleach their skin, and now that has gone out. And now we have dark girls, dark beauty, and the rest. Maintain your black, whatever, chocolate
Melanin.
and the melanin.
Yeah.
Okay, and we still have that now. Perhaps this BBL of a thing too. It's just a phase and it's going to fizzle out. Do you agree with that?
Well, Nigeria is a conservative country. You know, I think the level of conservation in terms of the cultural and religious part of Nigeria seems to be, you know, there is a little bit of dilution because of the Western kind of lifestyle the younger generations tend to adopt. You know, there are some lifestyles that are not Nigerian that we see. Do you understand? So, for an instance, some Western countries like the US, maybe 1 in 6 people must have done some cosmetic surgery. So is that common? Before now, is that common? So we're now beginning to imbibe some of those, you know, Western habits. That's where the cosmetic surgery come into play. You know, yeah, whether it will fizzle out with time is difficult to say because it's just starting in Nigeria. Funny enough, it's just starting in Nigeria. You know, the wave is so strong. You know, people want to look good, especially the younger generations. You know, so and the beauty doesn't fizzle out. You understand? Looking good does not fizzle. Just like saying, can fashion fade? It might be modified at different stages, but fashion will always be there. Hairstyles, there are hairstyles that are done before that are no longer done now.
Yeah.
So there might be some new trends that will still, you know, in that line.
Okay.
You
So to not
understand?
totally go out, it can just be.
It's unlikely. It's unlikely, especially now that the wave is just beginning to rise. You know, more celebrities seems to imbibe in the procedures and flaunting it. You know, people who are influenced want to, people who admire the celebrities want to check out the procedures, and it's increasing.
Okay, sorry, I want to ask this question. Is it possible for fats to be taken from somebody else and transferred into another person's body?
No.
No.
Impossible.
Why is it so? Because I was having a conversation on Sunday with someone, and she was like, she's very sure that it can be done. So I said I was going to have a guest, and then we're going to talk about it.
It's just like saying all the obese people are now fat donors.
Okay.
So if you have too much weight, come and donate fat.
Okay, so it's not possible.
No, it's not possible. It's not possible because the body will reject it.
So what happens to people, permits me to ask, people that are not overweight, or people that don't have fat in their body or enough fat, and they feel like, I need to have a bigger butt. So how do we get the fat and put into their body?
Yeah, you can only do with what you have.
What about implants?
Yeah, implants is another aspect. These days in Nigeria, there's been there's a kind of proliferation of non-cosmetic procedures.
Okay.
Implants and fillers. And for those who don't, implants used for butts is not very common in Nigeria.
But we've seen Nigerians who did it.
Implants inside the skin.
Okay, it's mostly common for the breast, right?
Yeah, more to the breast, but for implants to the butt is very, very uncommon in Nigeria.
Okay.
And then the side effects are even more.
Okay.
Yeah, because you have to remove it later, and you're sitting on an implant.
You have to remove it.
Yes, it's not permanent. Implant is artificial, it's under.
So even when you do it on the breast, you still have to take it out later?
If you wish to.
If you don't wish to, what happens?
Well, at the point you may need to remove. For instance, if it stays 15, 20 years, 25, 30 years, some implants might leak.
Oh, wow.
Okay, I would like to ask them. There's a question I really want to ask, but because you're a surgeon, I'd rather not ask it, because perhaps might spoil market for you. But let me hold it.
No,
I will ask it, but after this one, how do you deal with confidentiality, especially when people come into your office and they want to perhaps reduce weight or do BBL, and they come out and say, "Oh, I used tea." I used something exercise, and it was just like you said, people do it for different reasons, and you as a surgeon cannot really say anything about it because maybe you signed an agreement or something. How do you handle confidentiality? Yeah,
every client that walks through my door, that walks into my office, confidential, absolute confidentiality. It's not just about the cosmetic surgery thing. It's about being a doctor.
A doctor, yeah.
Every doctor, you don't divulge client's information for whatever reason. It's even more with cosmetic surgery. The client says, "No, I don't want anybody to know." It ends there. Nobody will know. Even if it comes tomorrow and say, "Oh, the television is slim tea," you have no right to say otherwise. It's confidential. It's confidential. So confidentiality is one of the top in the ethical practice. You don't ever disclose information concerning the client.
Okay.
So we're talking about the slim person before. So what's the option for that person? The person does not have enough fat in the body to put in the butt. So what does the person do? Because I don't know, sometimes I see some BBL that they do for some people, and the butt is actually bigger than the leg. Like, it's not proportional. It's not proportional. So I think, is it possible for a client to just come in and say, "I want this size of butt," and you just give it to the client? Or is the amount of fat in the person's body that would determine the size of the butt or the size of the leg? Like, I don't get it. The size of leg again.
Well, I've seen such pictures before. I understand what you're talking about.
Yes. It's too big for the knee can't carry it.
Are they complaining?
What I usually advocate is, if you have to, make it natural, make it look natural.
Okay.
It shouldn't look too made.
Okay.
Yeah, it shouldn't look made or artificial or that kind of thing. It should look natural and proportional to your body structure. The thing about fat is fat transfer in terms of size is relatively unpredictable.
Okay.
because when you transfer the fats, some will be lost. And it's difficult, yes, because if you transfer like 100%, let's say like 20% will be lost. So you can really not predict the percentage that may be lost in the process. You understand? So, but the bottom line is, the surgeon, for me as a person, as a surgeon, as a cosmetic surgeon, I aim to get in more natural contours than just blown off, you know.
Okay, I understand that it expands as time goes on. Is that true?
Well, yeah, research has not really proven that completely. You know, just like is your fat. If you lose weight, you lose fat. If you gain weight, so it's just like your fat is your body. It's your body. It behaves like your body.
Okay, let me ask one more question. For those who undergo the surgery and they come out, we often see them saying, "Oh, I cannot sit down for some days. I cannot do this. I cannot do that." So what's the rationale behind that?
The recovery process, what is it like?
Yeah, recovery process. Recovery process. Now, when you do BBL, you are not supposed to sit down for some time.
How long is that time?
Maybe 2 to 3 weeks. Is that long, right? but the other things, the other devices, pillows, you know, devices that you can actually sit with.
Okay.
Yeah, you can actually sit with, so it makes it easier with those pillows and devices.
Okay, things that are soft and
yeah, that's, you know, they'll take pressure away. The idea is that you don't want to put pressure on it.
On it.
You don't want to put pressure on it. So if you put pressure on it, you might, you might reduce the survival of some of the fats.
Oh, okay.
Yeah, so you want it the way it is for just that period of time, so that the body would absorb it. The body would, you know, accept the new location.
Okay.
And the blood vessels can grow into it and it becomes stabilized for that period of time. You know, after that, you just.
So within 2 to 3 weeks, you can recover.
Yeah.
Okay. Are there like procedures or like let me say, are they placed on medication for your lifetime, maybe supplements, or are there things they should do to maintain that particular body shape? Because sometimes I think about it, like, is it possible that you will do a tummy tuck now and tomorrow your stomach will be big again? Do you have to continue working out or using a waist trainer to hold everything in?
Oh, that's a good question. I get to be asked, what of maintenance? Somebody say maintenance. Do I have to maintain this new body I've got? Well, the thing is that there's really nothing like maintenance.
Oh, okay.
Yeah. It's not like you have to repeat or do something every year to maintain what you've got. The only thing you have to do is living a healthy lifestyle.
So that's another sort of maintenance in itself.
No, living healthy is not maintenance.
It's normal.
It's normal. You should be healthy.
Yeah?
Yeah, you should eat not too large, not too gluttony. Do you understand?
But there's a possibility that the stomach can increase again, right?
Yeah, there's substances, but not as it was before. Because the cells that are taken away are taken away.
Okay.
Yeah, the ones remain can increase in size. Maybe have a small cell because it takes more fat can increase in size.
Okay.
But so it cannot get to where it was before. Yes.
Okay, so what about the supplements, exercise?
No, exercise, like about exercise, yes, you have to maintain a stable weight.
Okay.
You have to maintain a stable weight. The stable weight is not because you did the procedure. The stable weight is because you want to live healthy. You want to keep your weight constant.
Okay, and people that do tummy tuck, you can still take in normally?
Yes, you can. Tummy tuck does not affect fertility. Tummy tuck does not affect pregnancy. Tummy tuck does not affect childbirth. The only thing is that because your tummy has grown again, you might lose some of the gains you've achieved with the tummy tuck earlier because of the changes that happened during pregnancy.
Okay.
You understand? You really don't need supplements after BBL. You don't need to do anything. Once you recover, then that's it.
Okay, as a surgeon, when an individual come into your office and say, I want to go under the knife, I want to do BBL or add silicone or whatever, do you advocate natural or you just go ahead and do your thing?
Well, what do you mean by natural?
Like, being yourself.
Self-confidence.
Self-confidence.
Self-confidence. Now, the procedures, the cosmetic surgery procedures are why. For BBL, are there too many cosmetic surgery procedures? For BBL, like I said, you know, it's the client's choice. It's just like saying, when you put eyelashes, why not go natural? When you put nails, I mean, you have your normal nails. I mean, why are you putting extra on the nails? Do you understand? I mean, God has given you the body. Why are you doing? But you have nails. Why putting nails? You have eyelashes. Why putting another eyelash?
The risk is not much. There's no risk.
Oh, the risk is not much. Oh, it's the risk that you're checking.
It's the risk we're checking.
Not whether you want to do it or not. So, but the point is, you know, people want to look better. That's why they put lashes. That's why they put nails. People want to look better in their clothing. You know, have better contours, flat tummies, maybe a little bit bigger butt, you know, so that they can appear more attractive, appear more confident. It is the choice.
Okay, so people with health conditions, can they also come for the cosmetic surgeries?
Well, if you have significant health condition, it has to be corrected first of all.
Okay.
Your health status has to be optimal. So if you're hypertensive and you're not taking your medications and the blood pressure keeps rising, it has to be controlled very, very well by the cardiologist before you can even think of it.
Okay.
If you're having any other health condition like diabetes or hormonal problems and so on and so forth, you understand, those conditions must be treated, controlled, and stabilized over time before you can go into it. That's why I said it's an elective procedure. It's something that is planned for the best state of health.
Okay, I was going to ask, because I laughed in the middle of where you were saying, I was going to ask if there was a place or a chance for reversal in case, in case someone says, I'm no longer interested, the BBL I've done.
Come and remove the fat.
Is there a place for a chance for having your body back to normal?
What do you mean by normal?
Of course, there are normal body where the way we came, normal body, but then the addition of BBL.
You're talking about the BBL now?
Yes.
Okay.
Is there a place or chance for reversal?
I've never had patient coming. I've never had a client coming to ask me.
But if there will be a client, do you think it's something that can be done?
Now the reason the commonest thing people come for is that maybe one part is not proportional to the other.
Okay, correct.
And they want to correct, either moving the one that's excess or adding to the one that is deficient. Okay, but not removing the fat.
Totally.
Not totally. I've not. It's difficult for one to come for that kind of request because the fat is your body. Do you understand?
Yeah.
It's your body. So, but if maybe you had a very large butt from BBL and you feel it's too large,
you can be reduced.
You can. Just liposuction. The way the fat was removed, that's the way it will be removed.
Okay, at this point, you're calling on us to leave the studio. Thank you so much for this session with you. I think I still have a lot of questions, but maybe we might have another episode with it because I wanted to ask what happens to the breast. How did is it that they remove the fat and use another skin? But we'll talk about that on another episode. Thank you so much for the time with us. I learned a lot of things. I think I can tell people now boldly, you don't transfer fat to another body. You get. Okay, that's all we can take on today's episode of Engendered. Do well to join us next time for an interesting episode. I remain Chidinma Ufomadu.
Well, I am Victoria Agbi. Do have a splendid evening.